The following is a paid program. WOR's airing of this program constitutes neither an endorsement of the products offered or the ideas expressed.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
Welcome, everybody. It's the Radiosurgery Show with Dr. Gil Lederman, MD, New York's only Harvard-trained, triple-board certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving into special cases, and, of course, answering your questions. I'm Rob Redstone, broadcasting from the WOR studios in the heart of New York City. And now, please welcome Dr. Lederman.
Hi, good evening. It's Gil Lederman. Welcome to the Radiosurgery Hour. We're live, and in the studio running the controls are Noah and Mike. They're experts in their field. And if you have questions for us, just call us. Noah or Mike will pick up. Their number is 1-800-321-0710. 1-800-321-0710. We'll get your calls, try to get you proper answers, or the best way to find out the answers. The purpose of the show is to try to get better health, better medical care, to learn about the medical system, and to make you better prepared to live a long, healthy, good, safe life. That's what we're trying to do every week. And I want to lead off with a lot of interesting articles and research that actually show how to get improved life, improved survival, less death. Sounds pretty good, right? And you have these choices. Many people have these choices, not everyone for everyone, but many for many people. The first is an article, scientific article that came out this week that looked at best kind of breast cancer treatment. What's better, mastectomy or lumpectomy and radiation? Now, unfortunately, some people have been saying or been led to believe that if you remove the breast that holds that cancer, you're going to be home free. Sometimes perhaps the surgeon says it. Sometimes the patient believes they heard it. Sometimes the patient believes it. But is it true? The answer is no. There's new research that's out this week that compares breast-conserving treatment, that is to keep one's breast after the diagnosis of breast cancer, versus mastectomy. In other words, there's a large retrospective study that shows the results, and it may be shocking to you, but that women treated with breast-conserving therapy, that means keeping the breast after the diagnosis of breast cancer, have a higher survival at 5 years and 10 years compared to those women who choose to have mastectomy. So it might sound strange to you. Why? But in fact, it's true. And after comparing differences among the patients, breast conservation was associated with a 30% improvement in survival versus mastectomy alone. This was published in a significant journal called JAMA Surgery. JAMA is the Journal of the American Medical Association. It was published this week, so it's new news, and may make a big difference for those of you who are just diagnosed with breast cancer or who have loved ones or might need to know this information in the future. You never know when something creeps up on you. So look at the data first. The data is what's so important. Sometimes how you feel, you'd feel that if they remove the breast, you'd be better off. but in fact, you're worse off, much worse off. And doctors looked at data from the National Cancer Institute's SEER data, which is a compiled data for many, many patients between 1998 and 2008 for early breast cancer, defined as breast cancer less than 4 centimeters, that's about 1.5 inches, almost 2 inches, with 3 or fewer lymph nodes. They found 132,000 patients. Wow, 132,000 patients. Now, if you have breast cancer in that criteria, the survival at 5 years was, take a guess, 97% if you saved your breast. It was significantly higher than if you had mastectomy. So there's reasons why, many reasons why, you do not need to lose the breast. For most women, I'm not talking about every woman, but for most women who are diagnosed with breast cancer, most women can have lumpectomy and radiation to the breast, save the breast, and avoid that scar and the implications that you have to live with. And we know that reconstruction is never the same as the breast God gave you. So this is very important data and can affect tens of thousands of women. In fact, there's about 250,000 women a year diagnosed with breast cancer. So it has huge impact on American society. And there's another important randomized study that looks at another very, very common disease, and that is prostate cancer. We know about 240,000 men in the United States are diagnosed annually with prostate cancer. Many men have been led to believe that it's not going to hurt them. They can do what's called watchful waiting. Watchful waiting means we just watch and wait and watch and wait. And actually, the cost of watchful waiting is more expensive than to get treatment. So what's interesting is watchful waiting is not so cheap. Now, is watchful waiting useful? And that's the question in this scientific paper. And listen to this study. It's a fantastic study, a randomized study, which is the best kind of study, when people are randomly allocated. Half have one thing, half have the other, and then you wait 20 years and see what happens. Well, in this study, between 1989 and 1999, doctors, and the doctor group was led by Anna Bill-Erickson, randomly allocated 695 men with prostate cancer to either watchful waiting or treatment. Again, 695 men randomly allocated to watchful waiting or prostate cancer treatment. And then they followed them until last year, until 2012. There were 23 years of follow-up. Wow. 23 years of follow-up, so it's a meaningful study, randomized study. And in the treatment group, 200 men eventually died. In the watchful waiting group, 247 men died. So 25% more men died in watchful waiting than in the group that were treated. And the relative risk actually dying of prostate cancer was 56% higher. So a huge difference between the two groups. This should give pause to every man out there who's listening who is doing watchful waiting. And we talked about this article during the week with some of our patients, and it has had a profound effect. When people understand that watchful waiting may be dangerous, maybe even lethal, it may well change one's opinion. The doctors concluded that this extended follow-up shows a substantial reduction in mortality, meaning a reduced death rate after treatment. So it's a very important paper and something you may want to look at. You may want to come in and see us and talk about your case. Because if you have an early prostate cancer, PSA less than 10, Gleason 6 or less, that's an early cancer with the vast majority of men cancer-free years after treatment, with a good quality of life, and in our hands, avoiding radical surgery or the complications of radical surgery, like leakage of urine, loss of sexual function. So again, we're live at the WOR studio tonight. Our number is 1-800-321-0710, 1-800-321-0710. So I always say it's best to call and ask rather than just to think. So don't be bashful. We had an interesting man come this week for consultation and to devise the best possible treatment. He is a 75-year-old man, separated. He has one daughter. And over the last 8 weeks, he's lost 30 pounds. And during this period of time, he's had this tremendous urge to urinate and defecate. So it's suggesting something is very serious wrong with his body. 30-pound weight loss with this pelvic urge. He went to one hospital in Manhattan, and he was sent out. Nothing was done. He was so upset. He went to another clinic, sent out. Finally, he saw a gastroenterologist who did endoscopy and colonoscopy, and the colonoscopy found a large rectal cancer. So it was just done a few days ago. He's had blood from the rectum in the bowel movements a month ago. He's short of breath. And he got a PET scan showing disease in the rectum and the tissues around the rectum, and a question of a lymph node in the center of his chest, the center between the right and left lungs, which is called the mediastinum. So that's how he came to us. We got blood tests and found his hemoglobin was 9.2 and his hematocrit was 31, so he's lost about a quarter or more of his blood. Part of that blood is probably leaking from the cancer growing through the rectum. Part of it is probably the cancer's effect on the body. So luckily, he came to us. He's obviously upset he didn't come to us 8 weeks ago. So we confirmed the diagnosis. We got copies of his reports, so he has them, copies of his PET scan, so he has them. And we were able to commence his treatment. And the goal of the treatment is to shrink down that cancer, hopefully stop the bleeding and stop those painful symptoms, and put him into remission. So he came to us with a rectal cancer that was advanced, 30-pound weight loss, and pelvic discomfort. He's now hopefully on the road to recovery. And we'll report back to him over the next 6 to 12 months, and we wish him Godspeed and good health, great recovery. We're going to hear from new voices talking about radiosurgery and our center at 1384 Broadway. We'll be back in just a couple moments, so call us at 800-321-0710 if you wish.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal too. He's first in America, first in New York, first for you. With Body Radiosurgery, we hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic, large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212-CHOICES, 212-CHOICES.
With Dr. Lederman, the best prostate cancer treatment is custom-tailored for you. Each man with prostate cancer is unique and seeks the best results based on PSA, Gleason score, and stage. That's why Dr. Lederman's custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid, accepted. Call Dr. Lederman at 212-CHOICES, 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR